And here's the cold hard truth that anyone experiencing a headache or a migraine would absolutely hate is that you say, don't use drugs that suppress the symptoms that will actually make your headaches more chronic and your migraines more chronic. So you're saying don't take the Advil and don't use prescription drugs, which that sucks for someone experiencing and going through that. So what can they do?
Yeah, can I just reinforce that for a minute and explain that? Because when a person has a headache, let's say, and they take even a Tylenol or an NSAID, like a Motrin, and they feel better, that sets the stage for turning an occasional chronic headache, an occasional tension headache, into a chronic migraine syndrome. Because now you start treating these things, studies show even twice a week of medication, even 2 times a week of something like Motrin or Advil, can cause you to have more headaches occur on a more rebound basis. And then doctors give you drugs to take away headaches. They used to be, when I was in medical school, Esquit, Vanquish, Excedrin, Furanol, Furoset, Midrin, these drugs, whose active ingredients used to be barbiturates, narcotics, and caffeine, which stop the headache, right? Now we use triptans to stop the headache, but they have the same, they cause the same long-term problems. They lead to medication-induced headache syndromes, and most people with chronic migraines, a large contributor to their migraines is the fact that they've used medication to stop the migraine, and now they just get migraines all the time now, and they have to be on drugs. And now they're looking to take medications prophylactically, like beta blockers and antidepressants, so they had less migraines. So it's just this idea of headaches and migraines in a kind of nutshell explains the problem with medicine today. Mm-hmm. The symptomatic relief, making a person feel better by making them sicker. And in my 35 years of practice, I've had to slowly wean people off their headache medications while they're taking excellent nutrition. And they may still get some headaches, and we're using ice, heat, pressure. We're using things, massaging. We're doing what we need to do, but we're getting them off the medications. They're suffering through some milder headaches because they're eating better, but eventually with the hope that they will get rid of their headaches long term and not have headaches for the rest of their life for the next decade. And I've been so successful with so many thousands of people, freeing them the need to have severe headaches. And I know if I could just give one quick example here, one quick case study. Here was a girl, she was 16 years old, and she spent 3 years in bed. And she was going to all the top neurologists in the country. They even put her in a hospital because she couldn't go to school because her headaches were so bad. Mm-hmm. And she was hospitalized in Brigham Young in Boston, if I can mention the hospital, for the neurologic headache specialist in the world. And they were giving her experimental IV drugs to get rid of her headaches. And whether they succeeded or not, they keep coming back again severely. And she came to me as a patient, and I said, you've been suffering for 3 years with this headache. Can you give me 2 months of your life? Can you let me work with you? Because I'm not going to get you well in the first month. Can you promise me you're going to give me 2 months and not judge it on the first outcome of the first 2 weeks? Because it may even make your headaches worse. Mm-hmm. And the family was there, and she was there, and she said, I've suffered enough. I'm going to listen to you. I'm going to do it. And what do you think happened? So that's right. It got worse initially. We took her off the medications. Gradually, of course. I stopped it gradually. Made her diet. She was drinking the smoothies, the juices. And she said, I would eat sawdust to get well. I'll eat anything you say, to get well.
She was desperate.
Yeah, desperate. I'll eat sawdust.
Poor girl.
And she got well. She went back to school. She went on the school's cross-country team, and she was elected president of the high school. And she went to college as a successful, and she's had a successful life. This is a person 3 years in bed, unable to go to school for 3 years.
Yeah, I love these heartwarming stories.
Me too. And also, to further Dad's point, he was talking about how traditional pharmacological drugs can perpetuate your propensity to have migraines. But then I go to naturopathic medical school where I had mold toxicity and was a sufferer of headaches and migraines. So people kept telling me, why don't you take magnesium glycinate, this and that? I'm like, no, I just need to get to the root cause. One of the principles of naturopathic medicine is get to the root cause of conditions. So I'm like, why are we using all of these supplements to just mask the symptoms just like drugs when we can actually get to the root cause and you can get better? And I'm another success story from Dad of how to get rid of migraines because I went through it myself and he helped me and I don't get migraines anymore. Yeah. And it's so cool because not only did I get through it with him, but I also know of certain techniques that help you get through the process because like he said in the beginning, you're not just going to say, I changed my diet today. I don't have migraines anymore. It takes a few months. For me, it was like getting out of the mold, but also you can go, for me, I would get Thai massages during migraines, which helps the severity a lot. And typically, you can call a Thai massage place and get a massage within 10 minutes, have someone drive you there.
Or any kind of, brain kind of, any kind of brain, neck and head,
any
neck massage.
tension. And you get a jade roller, like an ice roller. You keep it in the freezer and you put that on the area that you're getting a migraine in a really dark room. And it can help the pain without having to take something that is going to make you get a migraine again in a week.
Right. Totally. And it's really cool on drfuhrman.com to see, everyone will talk about their weight loss, which is amazing, and how they reverse this condition and their A1C is better. But I see so many stories that mention, and my migraines went away and my headaches went away. Like, it's just so interesting to see how that couples with so many different health concerns and how many people it's affected. I can see the thousands of case studies.
Right.
Well, also because we're talking about migraines here today, but what I think is important to mention is that this is also brain fog, fatigue, a typical headache, just where you feel that tension over your forehead, under your eyes. Like, it's not just that severe migraine where you're throwing up and have to close the door and get all lights out.
Right.